Hi everyone. If you can, if you can see me or just hear me, first of all, it's gonna be good. Maybe we have some kind of delay now. I don't know if you're hearing me now. Okay. Let's wait for Anna for feedback that everything is fine. Oh yeah, you can hear me, so everything is fine. So let me just switch to my web camera. Perfect. So hi everyone. Today is second edition of our Endo Coffee, and it's a free webinar for our colleagues, so where we can share our knowledge and some tips and tricks and so on. So my name is Oleg, and I'm from Ukraine, from Kiev. Yeah, and today I will talk about Reendo files. First, when I was thinking what topic I will talk about, it was Reendo files. But then when I started to prepare, I thought, well, maybe I'm not using only Reendo files. I'm also using during my retreatment Azure files. So I decided to switch the topic, and now I call it how I'm using Reendo files and Azure files together. So let me switch to my presentation. Okay, so yes. So as I told you, the topic will be using Reendo files and Azure files together in retreatment. I think this is quite interesting topic because, for example, in my daily practice, retreatment is the first thing that I'm using 99% of all my working time. So that's why the topic is really is common for my treatment, for my practice. Okay, so let's switch to the presentation. And first thing, for those guys who meet me just first time, let me introduce myself. So I'm working for 15 years already, and I'm just working. My practice is just limited to endo, so I'm not doing any kind of restorations. I'm not doing implants. I'm just doing endodontics every day. So this is my life. I'm also have a PhD, and I'm co-founder of Ukrainian Endodontic Society. Also a member of American Association of Endodontists, and I'm lecturing worldwide. You know that today is after our coronavirus, we're all locked down, but anyway, I hope and I believe that everything will change and we're gonna meet each other somewhere in the world and we'll talk and sit and have a coffee for sure. So let me start with one case that was in my practice some years ago, and this is quite good case where you can see everything that can be found in everyday's endodontics. So I will make the pointer. Okay, so my red pointer. So what we can see here, we see the tooth number 26. And we also can see that there is a mesial system, there is a distal system. We can find here palatal aspect, and also what we can see that there are changes in the mucous membrane. So we can see that there is enlargement of mucous membrane. Also, on an axial aspect, we can see that there are only 3 canals that were done in the previous treatment. And as we know that molars, they should have at least 4 canals. So we see all canals were obturated and were shaped up to the length, but the changes in the sinus in mucous membrane tells us that something is wrong. So what we have to do, first of all, we have to make retreatment. And here's the recall in 6 months. And as you can see, and you can compare. So first of all, you can see that there are no changes in mucous membrane. So and it's quite good, yeah. When you can see that it was very thick, and now it's very thin, about 1 millimeter of, like, in normal condition. There are also 4 canals, yeah, if we will compare with initial treatment. And we can see that we enlarged and removed the main debris, or the main part of biofilm that there was in the canal. So now we have cleaned and shaped properly our tooth, and we can achieve a good result. So what instrument to use for treatment? And as I told you, today I will talk about using Reendo files and Azure files, and why I'm using it. So Reendo files, you know that they are from nickel titanium, and if you'll check what kind of ISO they have all of their tips are 30, and they have only different tapers. So I know that the first file that has one circle, one wide circle, it means that it has taper 20 to 12, and the tip is 30. All the same, all others will have different kind of tapers, but the tip will be the same, 30 by ISO. So it gives ability for you to work with them in large canals and in small canals. Also, I think you are rather familiar with Azure files, and why I like them, because of their flexibility and of their properties. They give you ability to work in a curved canals, and even if it is retreatment, they will work good. And when we are talking about retreatment, first of all, I would like to tell you the idea how I make my retreatment in everyday practice. So I have a protocol, and I would like to share with you with my protocol, so how I'm using it. So first of all, I divide all my work in 5 parts. So first part is diagnostics. When we will make X-ray, we will measure working length on the X-ray, or CBCT is better if you have access for the CBCT. Then we're gonna perform the access to the cavity, to the canals, sorry. And after that, we'll make primary shaping. So we'll desobturate the canals, and we'll try to go to the length that we measured in our X-ray. After that, we'll confirm working length. And what we have to do at final step is just to enlarge up to 40 or 45, so to remove the biggest part of biofilm that can be in the canal. Let me show you how it works. So first of all, for example, in this case, tooth number 47, I will plan to make a retreatment. So first thing that we have to do is to make X-ray. If you have just usual X-ray, it's good, but don't forget to make it in a parallel technique, so that you can measure. So you can measure the length, or it's better if you have CBCT. So you can make the measurement. For example, distal system will be about 19 millimeters, mesial system will be about 20, and even if you will look at the frontal view, you can see where the mesial system, they are joining together. So I even can measure the point where they are joining. So after that, we'll go to the axis. And if it is distal system, so if it is rather big system, we can use from the Reendo files, we can use first one. And if it is a mesial system, we can use first or second one. So it depends on the on how it depends on the canal, as we say. For example, it's better for example, for buccal system to use second one because it's not so wide. But in the distal system, when you have a wide canal, it's quite good. The taper for about 12 will work good. After that, I will not say about easy canals like distals or palatal. I will talk now about mesial systems that are more complicated. How will work? So we'll go step by step further, and we will remove more previous material by using third and fourth instrument. So the fourth instrument usually stops at the half of the canal or at 2/3 of full length that we measured on our preoperative X-ray. After that, if the canal is rather curved, I would switch to Azure files. Why I will do this? Because of their properties. So that's why I'm trying to combine Reendo files that are usual nickel titanium with flexible Azure files, and it gives you the better result, and it gives you more abilities to work in a very complex anatomy. So after we've done primary shaping, I would like to confirm the length. And usually we're working with the apex locator, but you can always check yourself with an extra X-ray. And if you are at the length and you are happy with your length, what you have to do, you have to make the final shape. So the final shape will increase the diameter of your shaping of your canal, and I would like to shape till 35 or to 40 or even 45. So I will work in a single length technique. So after I confirm the length, I will go 25 or 4, then 30, then 35. So it will be like usual increment of the canal. But then if the canal gives you ability to increase more, so you can increase it more till 40, 45. Again, you have these instruments in the kit that you can find, for example, in Azure kits. So they have a they call this big one, yeah. So big one kit. So what we have our preoperative X-ray, and we have our post-operative X-ray. And as you can see, I've done the mesial system, distal system, and I prepared already the place for post. And then I referred to that dentist, to the prosthetic dentist, yeah, who gave me to make a good restoration with a post and crown. So this is the idea. And one more time, we're making X-ray, we're making measurement of the canals. Then we make the access, doing primary shaping, confirm the length, and after that we're making enlargement. So the main thing of the enlargement is to remove the more biofilm you will remove, the better you will have the result. So usually, if it is mesial system, I can stop at about 40. If it is distal system or large system, you can stop at 45 or even 50, 60, and so on. So it's a good idea to in retreatment to enlarge more, because you are trying to remove more biofilm. So this is the idea. And now let me show you some cases that I've done through this month. Yeah, for sure we've done more cases, but I will stop on these ones, so that are more common in the practice. For example, this one, tooth number 26, and what we can see regular situation. The regular situation means that you have a problem with a missed MB2 system. So here is MB1, here is distal system, and there is palatal, and this is MB2 system. So usual problem of all molars, and I think everyone is saying about that. So we have not to miss any canal, not to miss anatomy. So that's how it looks after I removed all the material from MB system, distal, palatal, and I shaped MB2. And this is how it looks after the work was done. And this is final picture. and X-ray. And even on this picture, you can see on this X-ray, even you can see the patient's thumb. I think he was. I told the patient, just can you hold it? Yeah, and he was holding with his thumb. And on this X-ray, I can see, as you can see here, you're gonna find also like we can make a diagnostic of his thumb. Yeah, sometimes it's very funny things you can find on X-ray. Let's go to another case. It was tooth number 36, and somebody was trying to make retreatment or something with his tooth. Anyway, the patient was not satisfied, and he came to another doctor. The doctor referred for me. As you can see, I removed all previous material, and here on this diagnostic X-ray, you can see how I'm using Azure files to check the length. So that's how they look like on an X-ray, and this is the clinical picture. As you can see, the mesial system from lingual aspect, from the buccal aspect, how it was cleaned, and I was rather satisfied of that. And here how it looks after treatment was done. For sure, the tooth number. Sorry, it was not 36. It was 37, because this is the tooth number 38, and tooth number 38 will be extracted because there is no antagonist. And but I was thinking, let me make endodontics in this one, but they already extracted. So let's go further. Again, tooth number 26. As you can see, there is a screw in post. There is some kind of material that you can see in palatal, some kind of material in mesial root. Again, when you see these cases, usually MB2 system is missed. So after the case was done, it's looking like this. Yeah, and let's go further. This tooth number 37 again, one more. I don't know how it's in your countries, but sometimes we can find very rare material. We'll call this Russian red, or we call this in our country rezarcinol. So if you are working with this, first of all, you have to remove it by using ultrasonic, and then you can go with Reendo files. So again, if you will try to use in these cases directly Reendo files, you can go off axis and you can make a perforation. So this is not a good idea if you will go straight with them. But anyway, if you have such cases, you can first of all use ultrasonic, and ultrasonic is a really good idea. And then you will feel that the material is not so tough, it's not so rigid, and you can use your nickel titanium instruments. Okay, so we removed all restoration that we have. Then we remove this material, and then let's go. And then we check the length, because sometimes in our apex locators, they're trying to show you one thing, and then you understand something is going wrong. Then what's a good advice for you if you feel that something, that apex locator doesn't work properly like you want? So it's a good idea to check yourself. So I do it every time if I have some thoughts about something is going wrong. So I will definitely use an X-ray. Now I can see that everything is fine. I'm at the length, and that's how it looks, the final result. I'm very satisfied, and the patient also, yeah, he liked this, and but he doesn't understand the endodontics, but anyway, he likes that he can achieve a good result of that. One more case. Sometimes when we're working with retreatment, again, we can see some old material. Yeah, we remove the restoration, and we can see something is there, but it's not rezarcinol. So you can it's not so rigid. So you can start with Reendo files. But what we can see, there is a small broken instrument like a lentula. So, and using this X-ray, I definitely know in which canal it is the location of the instrument. So it is located in mesial buccal, because mesial buccal canals, they always have this curvature from, yeah, so they have like this. I told the patient that there is a one obstacle that we need to remove. So there is a lentula that we need to remove. It was rather easy for me, because when you are working with endodontics every day, and you know a lot of techniques of removing the instruments, so I'm using the technique that is taught by Yoshi Terauchi. I think everyone familiar with him. So he's a genius in this thing, and not only in removing all the instruments, but in endodontics. So it took me about 20 minutes, or maybe less. And then we check the length, and then we achieve the results. So we didn't remove too much dentin. So using these techniques, you will be safe, and it will give you ability to make predictable removing of the instruments. One more case, the same technique. Now you can find it was in this case there was a post, and there were crowns, but the restorative dentist removed it and referred to me. So what can I see now? I can see one more instruments, and now I can see that there is again lentula, but in lingual canal. So as I told you before, vestibular canal will have the curvature, and the lingual will not on X-ray. So using again these techniques. So first of all, I measured, then I made the access using Reendo files. Then I was using also ultrasonic, and we removed the instrument again. And now you can see this moment. Can you see it? It's over here, so it went from here to here. But it's quite funny moment, because you know, when you are working with a patient and the rubber dam is placed and you want to make an X-ray. So I'm just removing the frame, I'm putting it to the side, and this instrument just went out from the canal and was on the rubber dam. So I didn't see it, so just move the rubber dam to the side. And when I was making the X-rays, so the instrument was in the rubber dam. So when you're looking at this picture, so you can see that it's in a rubber dam. Again, one more funny moment that you can meet in your practice. And then we've done this. This is the final X-ray. So what you can see in a mesial buccal aspect, we were removing more dentin, because there were a ledge, and the ledge. Now I will tell you in the next case how we can bypass the ledge. So this case is here. So what we can see, again, resorcinal. So it's like Russian red material. So it's rather stiff, rather rigid, and rather tough material. So what we can do, we can start by removing with ultrasonic, and then we can go with our Reendo instruments, and they will go up to this point. And after that, what we have, usually when the previous doctor made a new canal, so he went to the wall, dentinal wall, and he missed the main part of the canal. So he always say transport the canals. So what we have to do now, we have to find the real direction of canal. So what I can do, I can use Azure files. I can bend them. I can make in the same direction, and trying to find the right way. So why I'm using a combination of Reendo files and Azure. So with Reendo, I can make the access. I can remove the main material that was before, that was made before, and then using Azure files, I can bend them. I can try to find the right way. And let me show you the result. The result was rather good. It took me a lot of time, but about, I think, 3 hours or maybe more, because each of these canals, even in a distal system, it was with a ledge. So again, to find the canal, it took some time. But thank we're having nice instruments like Reendo and Azure files that can help you in your everyday treatment. So what I'd like to summarize or say some words at the end. So work with Reendo files in complex or in a difficult canals, usually till 2/3 or even a half of length. It will remove the main part of previous material, but then use Azure files because they will give you flexibility and they will help you to bypass the ledge and so on. Normal enlargement of the canals are about 35, 40, 45, and even you can go 50, 55. So in retreatment, I would like to enlarge more and more. And don't forget that sodium hypochlorite is our main solution that we are using in our practice, because after each instrument we have a lot of debris that we need to remove. That's why sodium hypochlorite is our like a main solution that we're using in our practice. So let me come back to maybe you have some questions. Let me check. Yeah. So the question is, the man Ali is asking, I have a problem in retreatment. I usually do ledgers while removing the old gutta percha. How to avoid this? So Ali, if you have ledgers, again, and don't push too much on the instruments when you're making retreatments. Use ultrasonic and use instruments that are more flexible. And if you have some kind of microscope or loops, they always will help you to see where you're going. So these are good tools if you can use them in your everyday practice, and they will really help you. So if you have some more questions, let me answer you if you have some more questions. And while you're thinking, don't forget about one more Endo Coffee session that's going to be on 9th of July with great doctors, with Piotr from Poland and Jenner from Guatemala. Yeah, they have very nice topic about ultrasonic and removing unbroken files. I think they will explain you more than I was talking today. But anyway, well, if you don't have any questions more, we are right in time, just 30 minutes gone, and I would like to thank everyone. And I think if this information help you in your everyday practice, I will be glad. Even if you will have some more questions later, you can always find me in Facebook or find me in YouTube, anywhere. So please welcome and thank you so much. And I would like to thank the organizers that they that make this new session. And thanks Paul Dent for this nice instruments that help our life of endodontics. So thank you one more time and see you. Bye bye.